Welcome back to Living Local. We're in Texarkana today with Dr. Dewitt Fortenberry, Medical Director of Post-Acute Medical Specialty Hospital of Texarkana. Thank you so much for joining us today.
Well, thank you. Thank you for having me.
I know we have a lot of really important information to talk about today, so let's go ahead and jump on in. Let's talk about why patients are typically referred to Post-Acute Medical Specialty Hospital of Texarkana.
Well, that's a good question. And to start off, we are an LTAC, which is short for long-term acute care hospital. Our patients have complex medical problems that usually have an extended care plan. So we bring them in from often the intensive care unit or even skilled nursing facility in some circumstances, and we take care of their long-term needs with an integrated treatment plan, basically.
Okay, I got you. So it's not just like a quick stay at the hospital. There are a lot of differences, and let's talk about the differences between Post-Acute Specialty Hospital of Texarkana and somewhere like a nursing home or a rehabilitation center.
Yes, well, the patients that we receive often need 24-hour nursing as well as daily physician visits, and that kind of care is often not available at a skilled nursing facility.
So it's very specialized to post-acute medical.
I would say so, and the LTAC environment in general is able to provide level, even at the care of an intensive care unit. Some of our patients are on a ventilator, and in those cases we wean them from the ventilator if at all possible, and they have other complex medical problems that really need to be served at a higher level of care than what is generally available in the community.
Well, going more into LTAC and what is covered with that, if somebody's wondering, will insurance cover LTAC services?
Yes, that is a sometimes complicated question. Medicare itself will cover LTAC services. However, Medicare Advantage programs often consider us out of network. However, we do have a team of specialists who help patients navigate that kind of problem, and usually we come to a workable solution.
I gotcha. So you do your best to work with each patient and help fit the situation.
That's correct.
Well, what should I be prepared for when I admit to Post-Acute Medical Specialty Hospital of Texarkana?
Well, one thing that's very important for our patients to realize is we are long-term, so the average length of stay is between 23 and 25 days, 3.5 weeks or so. During that time, we keep families up to date. Actually, we have an interdisciplinary meeting once a week, usually on Tuesdays, and family gets an update on the treatment plan and any changes in the patient's status. Otherwise, be prepared for sometimes changing visitation policies. Unfortunately, a lot of that's due to the current pandemic. But overall, we communicate very well with family and the power of attorney, whoever's making the medical decisions. And we have very good outcomes in terms of discharge back to the community, back home, back to their prior place of residence.
That's wonderful. So very involved. Nobody has to wonder what's going on. You guys break it down and explain it so nicely. Well, Dr. Fortenberry, thank you so much for your time today.
Well, thank you. Thank you for inviting me.
Well, we are going to put some more information up on the screen for you. That way you can find out more about Post-Acute Medical Specialty of Texarkana and how you can contact them and utilize their services. Yeah, some good information for you guys.